HHS Secretary Robert F. Kennedy Jr. following through on his mission to make America healthy again, announcing several artificial food dyes will be eliminated from the nation's food supply and medications by the end of next year. Kennedy has criticized the use of artificial food dyes in foods, saying the additives contribute to chronic disease and poor health. Here to talk more and about some other health headlines as well, we have the twin doctors, Idris and Jamil Abdur Rahman. Great to see you, Dr. I and Dr. J.
How
Good
are you?
morning. How are you?
Look, this is a massive victory for RFK. I mean, you can't slice it really any other way. And we've had food activists like the Food Baby, who's going to be on my show later this afternoon, who've been saying for more than a decade, and it's really fallen on deaf ears, that the FDA is asleep at the wheel. How big of a deal is this? Dr. I, I'll start with you.
I think this is really a big deal. So if you look at it, there are 36 artificial dyes that are being used in foods in this country. 8 of them are actually petroleum-based synthetic dyes, okay? And really, these dyes don't serve a purpose. What they're designed to do is make processed foods brighter, more vibrant, so you just want to grab them. But processed foods aren't good at all. Processed foods process all of the things that are good from a nutritional standpoint. But also, a lot of these dyes have been linked to a multitude of medical issues, many cancers amongst many of those things. And so there's really not a purpose to them. They have no nutritional value. They're just designed to lure us into eating food that isn't good for us anyway, and they bring their own risks. So I think this is a huge, huge, huge win.
Look, some people, they say that this actually doesn't have that much teeth. There was this big rollout last week on Tuesday, but there isn't a law on the books that is telling these food companies to do it. RFK has said that they're on board, you know, and hopefully that will indeed happen. But Dr. J, I'll let you take this one. You know, these food dyes in other countries overseas, they either come with a warning label or they're outright banned. So, like, is 2026, is that even too long to leave it on the market?
I mean, in my opinion, yes. I would like to see them getting rid of these artificial coloring agents yesterday. But I think it's a start. I think more than anything, it's starting a conversation. I think that there's a great deal of education that comes along with this rollout. And for the most part, people really weren't aware that, A, these dyes were in foods. B, I don't think that they were aware that they were dangerous. And so just having this conversation, I think, is a big deal because it empowers people to now make their own decisions. But would I like to see this rollout happen sooner? Yeah, absolutely. Would I like to see it made law? Absolutely. But I think this still is a start. And I think that's very encouraging.
Yeah, and this came out right after I gave my kids an Easter basket that were full of some of those foods that we have on our screen, and probably a lot of other parents are looking at them with a bit of a discerning different eye there as well. We want to cover some other stories too. Dr. J, you're an obstetrician, specialized field where your experience is really vital. If we can go ahead and pull this on up, is this a trend that you are seeing, and what are you thinking is the cause of the distrust? I think they're talking here about the distrust that we're seeing in folks who are turning to social media influencers and their peer and Google rather than, you know, talking to their doctors about their health concerns.
Yeah, I mean, this is something we're seeing more of, and it's not really surprising in a way. Number one, anytime you have the democratization of information, people are going to use information that's available to them, just kind of like we discussed about the artificial coloring agents. When people have information at their fingertips, they're going to use it. After COVID, people also became less trustful of doctors. I read a survey that said that prior to COVID, about 75% of people surveyed said that they would trust their doctors and healthcare providers. After COVID, about 40%. So when you have less trust, when you have more information available, and when you have third parties like insurance companies kind of intervening and coming between the doctor-patient relationship, it's not surprising that people are going to other sources, be it friends, be it family, be it social media, be it influencers. We're not seeing a lot of this in our practice per se, or if we are, at least people are telling us like, hey, I'm not going with your recommendation, doc. I'm going with influencer A. But I'm not surprised that we're seeing this at all.
Yeah, and Dr. I, when you see these numbers as well, I mean, what does that mean to you when you think about vaccine hesitancy at a growing rate in this country as well?
I think it means that we as doctors and as healthcare providers, we've got a lot of work to do because you're right. Even, you know, prior to COVID, there was a lot of vaccine hesitancy. There really has been for the last couple of decades. Post-COVID, because of all of the talk about the vaccine and safety and how it was developed, there's been even more vaccine hesitancy. And unfortunately, this vaccine hesitancy was not just focused on the COVID vaccine, but on all vaccines. And so I think it means that we as healthcare workers, we've got more work to do. We have to educate people properly. We have to listen to people. We have to hear their concerns. We have to address those concerns. So yeah, we definitely have more work to do.
All right, and Dr. J, let's talk about heart health now. Researchers have found that just 11 minutes of moderate exercise, that's not much at all, right? And it can drastically improve our heart health. Tell us about this brand new study.
Yeah, so there was a study that came out and it was a meta-analysis. So basically it took data from close to 200 different studies, 30 million people involved. So really good data. And what it found was just doing 75 minutes of moderate intensity exercise a day, basically walking, I'm sorry, not a day, a week, reduced your risk of overall premature death by around 23 to 25%. In part, that was because it reduced cancer risk by about 10%, reduced the risk of cardiovascular disease, heart attack, and stroke by about 20%. And so basically just walking 11 minutes a day can reduce your likelihood of premature death. And it makes sense when you think about it because walking is basically both weight bearing exercise and aerobic exercise. So you get the benefits of weight bearing exercise when you walk and the benefits of aerobic exercise, meaning less heart disease, stroke, risk of cancer, also means stronger bones. And people discount that, but stronger bones and healthier muscles helps to reduce the risk of falls. Death from falls and fractures from falls is one of the leading cause of morbidity and mortality in older women. And so, yeah, something as simple as walking 11 minutes a day can not only make you healthier, but it can prolong your life.
Yeah, without a doubt. And movement is medicine. And I'm a fitness trainer. And when people say, well, what is moderate intensity exercise? I say you can talk, but you can't sing. If you can talk, you're moderate. If you can sing, then you're not working hard enough. And if you can't talk at all, then you're working too hard. So that's that sweet spot, that Goldilocks effect.
Yeah.
Dr. I, Dr. J, thank you so much for your time today. Good
Thank you
stuff.
so much.
Always a pleasure.